Please hold on. Can you all see the screen, students? Students, can you all see the screen, please? Somebody answer just yes or no. Okay, right. Yes. Okay, so we are going to start the class. So I have some few housekeeping rules. So I got some comments from last week lectures. I got some students who wrote to me personally who said that who wants me to talk more in English and less in Sinhala. So I'm going to ask more questions. Only if you all cannot understand what I'm saying, you can ask in Sinhala, but I'll be answering and asking questions in English because I think some of the students want to learn English parallelly as well while learning healthcare management. And also the other thing is let's try and keep it minimum with the discussion with regard to the topic only. So these are the two housekeeping rules from today onwards so that we can make the maximum use out of the class for 2 hours, right? So like I mentioned before, those who joined the class lately, we are still in the same topic, but we are going to do on risk assessment. So today we are going to learn about what is risk management in healthcare. So can somebody answer like what do you all know, what is risk management in healthcare? Taranga, would you like to answer first? What do you understand by the topic?
Reduce the risk in working place.
Okay, like what kind of working place? Like what kind of working place? What is it?
Sector.
Yeah, healthcare sector. So it could be mainly in the hospital, but like I mentioned, whatever that we study is not just what you call specific to the hospitals per se. It is actually confined to like many other areas as well, right? So it could be a corporate sector, it could be a school, anywhere you could have risk. Like if it's a school, it is usually a lab, right? But because we're talking about anything risk regarding the healthcare, you need to sort of narrow it down to a healthcare sector, right? So the first point is healthcare risk management compromises the systems and process employed to uncover, mitigate, and prevent risk in healthcare institutions. So healthcare institutions means like it's all about hospitals. It's all about like anywhere that is related to patient safety. But we can also say when you have students in a school, what are the health risks that they can face and how we can mitigate those risks. Okay, and we need to know what is the purpose, right? Why do we need to manage risk in a healthcare sector? So it's mainly what is it? It's the safety, right? So like I said, when you are in a healthcare sector, you need to know you have to give safety for the people who you give the service, and also you need to make sure that you also are in a safe place to work. Okay. The second point, risk management in healthcare compromises the clinical and administrative systems that they are trained to identify, evaluate, and mitigate the risk to patients. Can somebody tell me what is the meaning of mitigate? What do you understand by the word mitigate? Anyone can answer. What do you understand by the word mitigate? Students, I think someone can answer. What is mitigate?
I think, hello, ma'am.
Yes, what is mitigate? What do you understand?
I think reduce that risks in a workplace.
Very good. Yeah, that's right. Mitigate means you're trying to reduce the risk. So like, for example, like I said last week, if somebody is working in a COVID hospital, how are the ways we could mitigate the contamination or the risk of spreading the disease from one person to the other person is by wearing the mask, the gloves, and taking proper safety measures and precautions so that you will reduce the spread of the disease from one person to the other person, and also you will stop by getting the disease to yourself, right? So that is how you mitigate. So different scenarios, different situations will have different ways to mitigate as per whatever the risk is, right? So like if you are taking a school lab, how would you mitigate chemical spillage, like say sulfuric acid or what do you call hydrochloric acid. So you need to store them in proper bottles, the way you place them, the way you use them, the way you handle them. Those are the ways you can prevent the risk. Okay, so place to place it differs, and situation to situation also it differs, right? So risk management cuts across the health system's entire ecosystem, impacting everything from patient safety and compliance to operations, HR, and operating margin. So like I said, if you have a sector, for example, if you take the hospital compromises not just the nurses and the doctors, but it compromises of the human resource, the HR unit. Then it compromises the what do you call the health and safety unit. So the whole thing is like a network. So you can't say, okay, mitigation of risk management happens only by the doctors and nurses. No, if you have so many units that is involved in a particular sector, everybody should know, okay, how are we going to mitigate the risk? How are we going to prevent the situation, right? So it's not just the doctors and nurses. If there are so many sectors working in under one department, like everyone needs to know how to prevent this risk. Okay, so is that understood, students? You can ask if you didn't understand anything from these first 3 points. Okay.
Understood, ma'am.
Okay. So next one is how to support others to comply with health and safety requirements. So if you take a look on your right hand side, okay, so I don't know what your side is, but if you can see the diagram, so you can see there are like ways we can ensure health and safety in a workplace. So that usually we have like 8 practices. So the first one is you must have a safety policy in a place, right? Now first week actually we studied the types of safety policies, right? Like, when you're handling chemical, you have a different kind of policies. When you're handling with patients, you have a different kind of policies, right? We learned around so many policies. So because I said the reason we have like so many policies is because the human handling is so different. Like when you are dealing with chemicals, you need to have the COSH forms, right? When you are handling a patient who cannot walk in a hospital, you have a different kind of sorry, I think somebody is joining. Okay. You will have a different kind of policy. Okay, so you need to know what are the policies based on the situation. So the first one is safety policy in a place. Then the second one is you must conduct inspections periodically. Like for example, let's say that you are gone to work in a research department or you're working in a lab. So the person who is in charge, who is looking after you or who is monitoring you, need to inspect you. Okay, are you doing the work properly? Are you actually fulfilling your duties as per the patient's safety? Are you protected? Okay, like are you wearing the mask? Are you wearing the gloves when you're taking a blood sample from a patient? So there should be like inspections periodically, at least a month, because the reason is humans they tend to like, be very easygoing, and if you don't have like disciplines and rules and regulation, they tend to like, work the way they want and do the things the way they want. So as a result, it can like, lose the discipline of a work, and you could lose the efficiency of the workplace can reduce, the quality of the workplace can reduce, which is why you need to have inspections periodically, right? And the third point is use science wherever applicable. Like for example, I think most of the times when you all go to a research lab, right, you would see like biohazard signals and signs. Like if it's a toxic or a corrosive chemical, they would have used these signals. Have you all seen that? How many of you all have seen these signs? Where do you see these signs? Can you all answer? Students, try to make it interactive. Like I said, I don't want to just read the lecture and go. I want you all to ask questions related to the lecture. So where do you all see these signs, and what kind of signs have you all seen? Fayaz, Taranga, can you all answer? Anyone? Students? Hello.
Normally, we see in the washrooms and lobby and all these areas, we see the signs. No?
Like what kind of signs have you seen? With regard to safety, what are the signs have you seen? Thank you for answering. Can you tell me what are the signs you see?
Like flow, slippery flow, be caution.
Very good, very good. Anything else that you can think of?
Like very fire
Staircase.
hazards. Yeah.
Very good, excellent. Fire hazard, excellent. That's a very good point because in case of an emergency, when there is a fire that has occurred, people need to know right which direction to go. Do they need to take the stairs on the right hand side or on the left hand side? Because that situation can be very stressful. It is a situation that can bring a lot of panic. So if people don't know where they need to take the direction, it can cause a lot of chaos, right? So that's very good. Slippery floors, a fire, anything else that you all could think? Another one more?
Yes, I think emergency information signs, there are safety signs.
Okay. Have you seen this skeleton-like thing with a cross? But what does that really symbolize? We would have worked in like labs when you are working in labs in chemical, when you have to deal with chemicals. Have you all seen those signs?
Personal protectivity,
Yes.
protective equipments
Yes.
signs
And
there.
also, don't use the phone sign.
Yeah, that's right. That's right. Don't use the phone. And have you all seen do not smoke? Have you all seen those
And
kind of many things, right? I mean, we see this in hospitals. We see sometimes in the road. Have you all seen when there is a construction, they put certain symbols. Uh, I mean, drive slowly or do not pass this area because there is danger ahead, right? So many, like even if you're like whoever has driving license, you all would have seen there are certain like symbols, right? That which we need to study before we take the driving license. So because you have to know because each symbol actually signifies something because for our safety. So that's what I said, not just healthcare management. It could have road safety, it could have hospital safety, it could have like general school laboratory safeties, right? So many kind of symbols there are to give a different kind of meaning, right? So the fourth one is you must provide regular training. Like I always said, anybody who joins a new job or does a new activity or a new research kind of thing, everybody needs to be trained. We will have certain skills within us, like somebody could be a fast writer, a fast typer, or somebody could handle the equipment very well. But every job will have its own protocol. Every job will have its own, methods that you need to follow. So when you are new to a place, you need to be given sufficient training. Why we give sufficient training is only then a person who joins the place newly will know, okay, this is the steps that needs to be carried out in this particular company. These are the things that they are expecting. These are the rules and regulations that I need to follow. So it is unfair if you don't train that person. You can't just say, okay, your first day, okay, do this. How will that person know if that person is not trained? So that is why you actually in a company or any place, you give them around 6 month probation because you need to sort of like investigate them. How are they performing? How are they working? Right? So you need to provide regular training. Okay, that's the fourth one. And the fifth one is provide employees with ample protective equipment. What does that mean? Can somebody tell me? Students, talk fast. I'm not scolding anybody. I'm trying to make the session interactive, like how we always do. What do you mean by providing regular with ample protective equipment? Ample.
Giving safety equipment to the others.
Very good. Like what?
Like we can give a mask or some kind of things and gloves.
Excellent, excellent, excellent. So these are something that you must provide. I mean, whoever, like I said, right, last week I said, every patient who is not only a patient, every person who is working in a say hospital or let's say in a place that you need a lot of safety and security, you have the right to ask your manager or your boss, provide me with gloves, provide me with goggles, provide me with what do you call mask, because these are my rights that I need to be safe when I'm working. So the company or the organization have you have the right to demand for these protective equipment. Is that understood? Students?
Yes.
Okay.
Yes.
And what about the next point? What do you mean by encouraging short breaks? What does that mean?
To have a rest once they complete some kind of stressful work. So to have some time of short break.
Yeah. Now, even for example, like when Ms. Ganguly conducted the lectures, like after 1 hour, at least you need around 15 to 20 or 30-minute break, because it's the normal human mind, right? Because we tend to get exerted, like we get tired, we get mentally deprived. So it's a must that sufficient amount of breaks are given. It could be any place, right? Regardless, whatever you're doing, you have to encourage short breaks. Is that understood? Like, you need to give short breaks. That is a right as well when you are working in a particular place, right? So that is what you mean by encouraging short break. And then you have the seventh one is you hire an experienced safety professional. What does that mean?
Qualified staff.
Like can you give me an example?
Like hiring a safety officer to monitor and guide others how to act on situations to maintain a proper safety.
It's like, like simple thing, right? For example, if you are joining a company newly, right? If you don't have a boss or if you don't have a manager to sort of report to or to tell what to do, what would you do? You would just go to the place, you would do whatever you want, sometimes not even do what is needed in the place that you require. You just go and come without knowing what to do. So that is why you need to have experience and safety professional, because if you do a mistake or if you do not know something, you need to be guided, right? So for you to be guided or for you to be taught about something, you need to have somebody who is above you, or somebody who is educated, or somebody who has more experience, who is well known about a subject. That is the only way you can carry out a particular place more efficiently. So that is experience and safety professional. That's why, like, even among us, sometimes if you apply for a particular job, sometimes they ask you, do you have experience in this particular area? Why they ask that is because it's easier for them also if they know somebody already has experience, because humans by nature are quite lazy to sort of train people or to teach or to explain, because that requires energy, effort, so people try to find the shortcut. I wouldn't really encourage, because that is not the right thing to do, because I feel there are so many people who could have a lot of potential, who could have a lot of talent, but only what they need is a little bit of guidance and training. So if you can provide the guidance and training, I think they would be suitable as well. So I wouldn't say that you hire people only based on skills and experience. No, I think everybody should be given a chance. Observe them at least 6 months. Are they catching up on what they were taught? Like that, you need to give some time. And the last is OSHA compliance. Can somebody remember what is OSHA compliance? Can somebody tell me what is OSHA compliance? Where did we study OSHA? What does OSHA stand for, students? The first one, I'll just give a clue. It stands for occupational. Can you tell me what it is then? Anybody wants to answer? OSHA? So we call it occupational safety health. What is it? Occupational safety and health hazard. Okay, do you all remember that? Somebody.
Yes.
Okay. So why do you need this OSH? Why do you need OSHA? Why do you need occupational health and safety hazard? Why do you need that? What do you mean by the term occupational safety health hazard? It's a very important term, which is why I'm trying to ask the question. I mean, to get the answer from your mouth, it's very important part. Why do you need to have a OSHA? Common sense, can you all answer? Like, what do you think? Students, are you all even there? At least answer yes or no. Do you all, can you all guess?
Ensure safety and health.
Very good. Yeah, answer, students. Please answer, right? I mean, that's respectful for the lecturer also, because when I ask a question, I prefer to have an answer. Okay, that's respect that I would want somebody to respond. Okay, because I'm also putting effort for the slide, so it's very easy for me to just read like a story and then finish the lecture. But because I want you all to retain it in your long-term memory, I'm asking the question, right? So yeah, so you need to have this. Because you need to have some kind of a safety that you're working, right? Because I told you, unless you have safety policies, it's very difficult to work in any kind of environment. Okay, so that is what you have to know when it comes to this 8 safety in the workplace, the practices, right? So the first one, again, if you go back to the topic, how to support others to comply with health and safety requirements, you must train the employees well. Okay, so this is basically trying to summarize what the diagram that I'm trying to say on the top. And the second one is you must reward employees for safe behavior, right? It's like rewarding a child when she performs well. You might give her a red or a gold star, or just give her a small candy, right? Why do we do this kind of rewarding is so that we can make sure that the people continue the good habits. Anybody who feels like they're appreciated, anybody who feels like they are recognized for what they do good, and when they are rewarded for that, that thing is going to be continued like forever. That's normal human nature, right? And the third point is a partner with occupational clinicians. So like for example, if you have let's say that you're working in a research department, and then somebody like the owner of the research department finds out, okay, we are running short of certain equipments, we are running short of certain chemicals, maybe we need to partner with this particular organization so that we would get sufficient say sponsor, so that we can make our place better, right? So you partner with occupational clinicians to make it better in the work area, right? And the other one is use labels and signs. Why do we need to use labels and signs? Like previously, most of you all like told me what are the labels and signs you all have used. So why do we need to use labels and signs, students?
Easy understandings and follow
Understanding and follow what?
the instructions according to the signs.
Exactly. Like even for example, if you don't have like roads, in the roads, if you don't have like say signs or the names of the road, you would not know, right, which road to turn, which road is the one that you want to really be at, right? So labels and signs are very important. Even in the airport, like if you don't know like which area is the immigration or emigration or departure arrival, we would not know where exactly we are going to land ourselves. So that is very important to have labels and signs. Okay, that's there. And you must have to have things clean, right? That's a very important thing. Like hygiene is something that is important, that we need to practice almost every day in our lives, not just in the workplace, but in our own home, in our own work, in our place that we study, in our place that we eat, in our place that we sleep. Like hygiene is something very, very important, like so for so many reasons. So you need to make sure that the place that you're providing to the employers is also clean, and that you also have a safe and a clean place to work. And also make sure employees have the right tools and have regular equipment inspections. So, right, like for example, can you tell me what are the right tools that you need to have if you're working in a health and safety environment? Can you all give me some examples? Right tools, what are the right tools? Students, can you all tell me what are the right tools? I'm not calling names because I want it to be anyone can volunteer, right? I'm not asking by names because everyone is free to answer. It's not a school where I'm calling names, so anyone can answer. What do you mean by the right tools? If you all are scared to answer in English, I don't mind. You all can answer in Sinhala also, no problem. Answer in Sinhala because I can understand. And anyone who knows what do you mean by right tools? Students, what do you mean by the right tools? If you are working in a health and safety environment, what are the right tools that you need to have? Hello.
Gloves in suitable sizes.
Very good. Excellent. See, students, you all are giving very, very logical answers. I like the answer because one thing you said, you gloves, and the other thing you emphasize suitable sizes. That's excellent because another thing, a place can be providing gloves, but it is actually they also need to show that people can be of varying sizes, some tall, some short. So it's important. Like last time I emphasized why you need to have the gloves of right size, right? That's very good. Anything else? Please answer. That's very good. Okay, gloves with the right size. Anything else? Students?
Goggles and mask and other things.
Yeah, so that is like, for example, if you're working in a research lab, right? But do you think those are the tools that you will need in other organizations also? No, right? The tools can be different as per the place that you work. Okay, so that also you need to understand. Like, for example, you're right, very good, like gloves, mask, everything, correct. And it should be on the right size, it should be like clean, right? All those things are important. But if an engineer is working in a railway station or in a road, what do they need? They will need like helmets, they will need special boots. So you need to be like flexible to understand when you mean by right tools in what kind of workplace. Okay. And the next one is, okay, I also need to mention what do you mean by regular equipment inspections. Have you all heard the word calibration, students? Calibrations. Have you all heard the word calibration? Yes or no? Just at least yes or no. Just answer so I can explain what is calibration.
Yes, madam.
Okay, very good. So calibration means like, every 6 months or every year, the equipments that you're using in the lab or in the research unit needs to be calibrated. Like why we need to calibrate it is because sometimes, the equipments can get, wear and tear, because of course, like just like our human body, when we keep on exerting our brain, we get tired. Or like when you stop eating, you can like really go thin. When you overeat, you can really get fat. Just like that, equipments, when you keep on using, they can have like wear and tear. So that's why you should have special people to come and calibrate the equipments. They need to come and see, okay, is this machine going to work properly? Is it still working properly? Why is it not working properly? They need to come and calibrate. Now, for example, just imagine that a patient has given urine sample or blood sample and they want to get the proper results. So these results are being generated by a proper machine. So if the machine is not properly working and if they're giving false results, and based on those results, if the doctor is going to prescribe medicine, just imagine the amount of health repercussions that can come. So just imagine if the equipment is not working properly, the results that is generating from that equipment is going to be having errors, and then the doctor is going to prescribe patients medicine based on that. So many things can go wrong if the equipments are not calibrated. So that's inspection is a must to see if these equipments are calibrated, are they working properly or not. And also, like I said, you have to give them breaks. Everybody needs a break, mentally and physically, right? Implement safety protocols from the start. You have to have labels and signs. You have to tell them what are the protocols. You have to guide them, train them, all that what we mentioned. What do you mean by keeping an open dialogue? What do you mean, Taranga? What is keeping an open dialogue? What do you understand? What is an open dialogue mean?
Can understand the dialogue, the
Yes, that's
thing
correct.
that can.
Yeah. Now, for example, what I have with all is an open dialogue, right? Because I want you all to sort of interact, participate. So you all have your own views when I talk on a particular point. Open dialogue. We discuss something, right? Based on what we are talking about. Like when I said safety, health measures, you all have your own views. What is health and safety, right? So that's an open dialogue, right? And have regular meetings on a workplace safety, right? Okay. Next, we are going to learn about record keeping. Who understands the word by record keeping? What do you mean by record keeping? So you can see on the top, I have mentioned about medical record, but it doesn't have to be a medical record. It could be any record. What do you mean by record keeping?
We are recording, keeping a note about the details what we were noticed and know.
Can you give me an example for what you said now? Where do you see medical record? Who takes a medical record? What are the general kinds of record? You can write even one essay about it. Why I'm giving you all these questions is because when you all have assessment for your exams, these are the questions that they can ask. So if you all bring in answers now, it's very easy for you all to do the assignment. What kind of record, like you all know, and why do you need to do record keeping? And who does record keeping? Who does record keeping?
I think such as pregnancy mother card.
Very good. Excellent. Very good. Excellent. What do you see in a pregnant mother's card? What are the things that you would notice usually?
Mother's weight and what are the vaccines she gives and others.
Very good. Like, so basically a pregnant mother's record card, like usually the name of the patient, how many months is she pregnant, what are the things that she's allergic, what are the vaccines that she has already had, because that's very important. Because a pregnant mother will usually go for a routine clinic, okay, because the doctor needs to check, okay, is the child okay now? Is the mother having any complication with the pregnancy as the months go? Because like you have routine checkups, right? So that's good. So for a pregnant mother, you could have a medical record. You could have a medical record for a psychiatric patient. So generally speaking, every doctor will have a medical record for their patient, depending on the sickness or depending on the doctor that they are looking. So we have so many specialties in medicine itself: psychiatry, pediatrics, right? Gynecology, right? So many kinds of fields. So each of those doctors in their specialties will have a medical record. All right. So that's one thing. So medical records management refers to a system of procedures and protocol responsible for governing patients' information throughout the entirety of the data life cycle, everything, name, the age. And do you think it's okay to show these records to everybody? What do you think about privacy? What is your opinion? Can everybody see
No.
this? Exactly. Yeah. Because that patient might not like, right? Doctor looking is another story. Nurse looking it is another story. Or somebody working in the research is another thing. But it's something that needs to be private. We will go through in the future slides what are the things that you need to be careful when you are doing record keeping. Okay. So from the moment a patient record is created, it must be appropriately stored, secured, and maintained. So now I need to like emphasize one thing. Like when I was working at NHSL, usually the records are usually maintained in paper or book in Sri Lanka. But do you think it's an efficient thing to maintain record like in books and paper? What is your opinion? Yes or no? Is it good?
No.
Yes or no?
No,
Why is it no? Why?
because it can be disappoint. No, so that mean it can be erased or missing.
Of course, yeah, it can be. Let's say there was a flood, let's say there was an earthquake, of course, these documents, these records could get, destroyed, right? So many things can be subjected to these records if you try to keep it physically. So, of course, somebody can argue, okay, what about if the laptop crashes, system crashes, then also you can you lose patient information. But that technology is now so developed that we have something called drives, you store in another area where you can retrieve even when it's deleted, right? So you have another department where you have software engineers and people who are special in those areas also come into these systems. So when you are like running a medical institution or a hospital, you hire not just doctors and nurses. I said, right, for a proper building to have build, you need proper architects because they are the one who knows how to bring in ventilation to the hospital. So just like they say the architects, you also need engineers. They need to know, okay, how is the light system going to work for this hospital? Where do these electrical system work? So many people come into the department when you come to healthcare system, not just doctors and nurses. And also for the record keeping. So if you want the records to be stored and secured digitally, you need to hire proper software engineers, right? So that it's not destroyed, that it is secure, it is maintained, nobody can hack into them, right? So many things. So there is a complex set of rules and regulation regarding medical record management, and for a good reason. So this is when health records are mismanaged, patients are put at risk. So what do you understand by the third point here? Students.
That mean that information about the patient that information about patient I mean by එළියට ගියොත් it will be a big problem.
Okay, can you add a little
and for personal information like details.
Like what?
Sometimes there are health problem like he's having some issues like in that kind of womb problem or some kind of issues that ඒකේ යාගේ family එකේ කට්ටියට හරි එහෙම ගියොත් එහෙම it can be very big issue no?
Yes, it can be Hari. So eka දෙයක්, that's correct. Very good. So that is why you need to know how you store these medical records and how you manage them, right? So that, like you said, so that you won't put the risk from you to another person. You understand? That's the main reason why record keeping is very important. Okay, that's the one that you need to know. Okay. Okay, right. So I think you all understood that part. Anyone wants to add anything? You all can talk if you have any other opinion for this point. Anything that you all would like to add?
Yeah, I think due to because of mismanagement, it might like nowadays that India also facing this like organ stealing from the patients because based on their medical history.
Yes.
So that's the main.
Very good. That's a good point. Okay, so I think you all are knowledgeable about that also, right? And the other thing, now we'll go to the fourth point. It says medical professionals have a legal and ethical obligation to protect patient information and properly manage records. So that already you all said, okay, why it's important. Like nobody has the right to just, go and take a patient's records, steal those records and, do whatever you all want. No, you don't have the right, only unless it's a doctor, a researcher, a nurse, someone who is directly involved with the patient has the right to access, because they are very, very confidential things, right? That is why, like especially even when you're like getting a job, only the HR should know if you're having something physically or mentally, because the thing is, when the whole workplace gets to know, especially humans can be kind of nasty people, right? They are not kind. They like to, all kinds of bullying can be happening. They can be bullied because this person has this kind of physical problem or a mental problem, because that is humans, right? Although humans have a high IQ, there are many occasions that humans don't really behave like humans. So that's why you need to keep these medical records professionally, so that the person who comes to a job is not discriminated, is not violated from his basic rights. Okay. So that's why you need to be having these records very safe. So absence of clarity, failure to record action, taken to meet an identified problem, missing information, significant spelling mistakes, and failures in communication are some of poor record keeping. Is there anything else that you all can mention about record keeping that you all feel is going to be poor? Poor record keeping. What are the other things apart from the red points that I mentioned?
Records are not in according to the order. Records mentioned not according to the order.
Yes, yes, yes. That's very good. Why do you think if it's not in order, what will happen?
Yeah, the obviously the medical because doctor might get he couldn't decide what are the medicine that he can give it, because he might know previous illnesses, and after the medicine what are the outcomes and all. But if it is not mentioned accordingly, then he'll get confused how to treat it further.
Very good. Yeah, that's very good. So that's why it's like, it just like if you are trying to apply for a job application or for visa or for whatever, there's an application form where you need to like put your details very properly, accurately. You can't make spelling mistakes. Your handwriting needs to be clear, right? You need to have, you need to give true information about yourself. You can't, forge your, date of birth, or whether your other basic details, because they are always going to cross check what you put is correct, right? Because they have a reason why you need to follow all these protocols, right? One is to make sure that the place doesn't have any corruption or unethical things would go on. All this is actually for a better workplace, for a better and healthy thing for yourself and for the people who work there, right? That's that. So again, importance in record keeping, if you go to see, so they say good record keeping is a vital part of effective communication in healthcare system, promoting safety and continuity of care of patients and clients, right? So a good record keeping assists in providing pertinent information. What can you understand by pertinent information from the word? Pertinent information, students, what does that mean?
Relevant.
Mm-hmm.
Relevant information that according.
Okay, good. Relevant information. Yeah, you can't like you don't need to like say, okay, I eat this, I drink this, I know. You relevant pertinent information, your name, your age, your date of birth, you have any sickness, what are your allergies, only thing that you need, only thing what they request for, right? That's very important. So that is the only way you can improve the coordination between the team members. Now, so in, for example, now in this online platform with y'all, like I need to know, like not all of y'all are like the same. Different people have different likes, different dislikes, but I need to understand like everybody is different. So that way I could coordinate with each one of y'all and to sort of give something that is commonly preferred by everyone, right? So that is like you need to have information so that I can sort of gather how to like conduct the class. So that's important for me to coordinate based on the people's personalities, right? So that is important, right? Again, record better patient care. why do you need to have better patient care? I mean, if you have record keeping, they are saying if you have good record keeping, it will give a good patient care. Do you agree with this? If so, why?
Yes, agreed.
Yes. So why would you have better patient care?
Like it's like then if we keep a record that we can easily communicate with the patient because we know the updates of the patient and we can support him for further expectations of the patient.
Thank you for answering. That's great, right? Anything, like I said, if you're, I told you, like working in a healthcare sector is not going to be easy because one thing is patients are something very vulnerable. They are suffering from a sickness and they could die depending on what situation they are in. So what, as a healthcare professional, if you are going to work, you need to be very mindful what is the best practice that you could do so that you could give end of the day the best service for them, right? So all these are important to maintain is because end of the day, just like how you could take care of yourself and how you could be happy with content with what you're doing, you also need to, your prime goal is to give them the best patient care. So all this record keeping can give that efficiency for a better patient care, right? It can also strengthen the patient's self-management and self-care. That is, if you have proper record keeping, you can improve in patient's outcome. Like, say, for example, a patient comes to the hospital. Today the patient was reported as having high fever, high infection, high diabetic. So if you have a proper recording from day one, at the start of the day, Sunday the 3rd July, the patient had diabetic, sugar level was this much. The patient had a temperature of this much. The patient did not eat. The patient had severe, dizziness. So then tomorrow, what you do, you based on these symptoms, you try to manage. So since the patient is having a high diabetic, you try to control the patient's diet by giving fibers, good water, all those kind of things. And then the next day you see, has the patient's sugar come down? Has the patient's dizziness come down? So could you see, if you have a proper recording from the start, from the day that you start until the week that ends, you could sort of see how the patient's symptoms are improving and a better outcome for the patient. So you are able to release the patient from the hospital by making the patient healthier and in a better way, all because of a record keeping. That's why when you go to the doctors also, they want to see the past medical reports. Did your signs and symptoms get better than before? Is it worse than before? Like that you need to see, right? Decrease time in gathering clinical information. That's also true, right? Like if you have a record keeping, every time the patient comes to the hospital, you don't need to tell, oh, what is your name, what is your age, what is your date of birth. No, already, if the patient goes for a routine clinic, already the records are already, it's stored. It's already recorded in the system. So only anything new that they need to sort of update or include. Okay. Avoid duplication of services. That's like I say, no need to keep on doing it again and again. Ask the details again and again. You don't need to do it. Okay, right. Now, I also mentioned this before. What kind of information do you usually include in a health record? Students?
Name, age, sex, and their illnesses.
Anybody else? Only 2 or 3.
Body weight.
Others answer yes. Sorry, what is it?
Body weight.
Very good. Body weight. Okay. Anything else?
Previous patients previous illnesses
Very
about.
good. Very, very important.
I think clinical history. No?
Yeah, clinical history. Excellent. That is, of course, a must. Like, have you all seen when a doctor tries to prescribe antibiotics to the patient, the first thing that they ask is, do you have allergies, right? Do you have allergies for the past, right? That they tend to ask, right? You need to have information about the patient's past medical history. What kind of vaccines do you have? What kind of allergies do you have? Were you a smoker during the past 5-10 years ago? Were you an alcoholic past 5 to 10 years ago? Every kind of medical information is very important, especially when a patient has come with a, say, a situation where the doctors cannot identify what is wrong with the patient, the past medical history is a must. The past medical history is a must. Is that understood?
Yes, ma'am. I think that depend on that situation.
Yes.
Uh,
Yes.
yes. Is there a met with an accident? We should mention basically what we are sustained that physically what we are observe that patient, no?
Yes. Yes. Correct. That's completely right. I just gave you an example, but generally information will always depend on the particular situation. Was it an accident? Was it a patient who was going to die through a sepsis coma, or was it because of a stroke? Of course, different situation. There could be so many situations, and it can differ from a patient to patient, right? So let's see. Individual up-to-date health records must be kept for each employee placed under health surveillance. These should include details about the employee and the health surveillance procedures relating to them. So, of course, you need to know their surname, their phoneme, their gender, the date of birth, what is their permanent address, including their postcode, national insurance number, right, date, present employment started. Now, this is, of course, the last one is depending on if that person is, yeah, exactly, right? If you are going for a doctor, you don't need to really say what job you are doing, but that is also actually, to be honest, like I don't know if you all have heard about rat fever, right? Rat fever, usually you get it in lot of farmers who work in the paddy field, because they usually don't work with anything in their legs, right? Barefoot they work, and usually in paddy fields, you know, you have these rats feces, like the fecal matter gets contaminated with the water. So sometimes if that patient had a cut in the leg, it can enter and you can get rat fever, right? So that's why it's very important. Sometimes the doctor can ask, what is your job like, right? What is your job like? So sometimes a psychiatric patient can be always asked, okay, what is your job like? That patient could be having a psychotic problem because of the stress in the workplace. So if that patient is doing something very mentally challenging, the doctor has the right to ask, what is your job like? Because I think employment, I would say to get the history of an employment is a must, because that sort of gives them information. What is the background of the patient is like, right? Is the patient a teacher? Is the patient a lawyer? Because really a patient's physical and mental well-being has a big impact on the type of job they do also. Really, that has a big impact. Okay. So recorded details of each health surveillance check should include the date they carried out and by whom. Now, for example, if I'm the one who's taking the patient's information, I need to put the date. I need to say I was the one who took the patient history. Like, for example, you know, most of you all must have had a experience. You would have experience in changing the doctor. Say today you went to Dr. M. Tomorrow or in a year or a month you will go to Dr. Z. Because of your own thing, maybe you feel the doctor is not good, or you feel the other doctor is better, right? So, but the previous doctor should have his signature when he has taken the medical history. So the next doctor would sort of see, okay, this was done by this doctor, right? Because sometimes, for example, a doctor can make a mistake, right? So, for example, a court or a police, they need to know which doctor misdiagnosed the patient. If the patient was dying because of a bad drug prescription, it can happen, right? So you need to know who took the medical history, and the signature of the person who takes the medical history needs to sign as well. Okay. The outcome of the test and check. So let's say today the patient who was a diabetic patient comes. So the patient had around sugar 249, very high. What could be the outcome? That patient could go to coma, right? You need to write that also. The decision made by the occupational health profession in terms of fitness for a task and any restrictions required. So you need to like write down how was the fitness level? Did you need to carry out any restrictions for these patients? Like, for example, let's say that somebody who's having high, say, pressure, right? You are writing a record. You need to like sort of avoid taking high consumption of salt. Sometimes a doctor, when they take a medical history, can write those kind of additional remarks. You need to bring your sugar down by taking this amount of medication or by taking this amount of diet. Okay. So those are vital information. right? And this should be factual. What do you mean by factual, students? What is factual?
Like practical.
Factual is something true and also, yes, practical. You can't just write everything. You can't write lies about a patient also, right? That's illegal, it's wrong. And it has to have a lot of ethics. So, when you are taking health records, it's another whole, discipline, another whole thing, how you take information. Okay, right. What are the key principles of record keeping, students? Can you all guess what are the key principles of record keeping? Anyone knows the key principles of record keeping? A given hint. First one, record should be completed at the time or as soon as possible after the event. Like what kind of event? Can you guess? Okay, let's say that a patient who was COVID and now is going to the really critical stage. So the patient now has come in an ambulance and now has been hospitalized to ICU. So what happens there? Do you need to make an immediate record? Yes or no?
Yes.
Yes.
Yes, you have to, right? Because it's an emergency situation. So I would say, as a normal practice, you don't need to really wait for a emergency situation. Anything you need to do a recording. Like just like when we were school students, something that was always encouraged was එදිනෙදා දෙන වැඩ පාඩම් කරන්න. That will be better. Like do your day-to-day work, because that is the way you will remember. You will not need to study a lot by the time that you have to study, by the time you sit for the exam. Do your day-to-day work. That's the basic thing that every student when we were in school were taught. Just like that, a record keeping does not, the patient need not be a one that is in a critical situation. Any patient that comes to the hospital or to the department, the one who takes the record usually is a nurse, needs to take it then and there, right? So that, because we are humans, we can forget. So you can't just say, just you dodge down the basic thing and later I will do all the record keeping for every patient. No, that's a very bad practice. Then and there you need to take the records of the patient and see all records must be signed, it should be timed, it should be dated if it is handwritten. This is something that the second point, as someone who was working in clinical trial, when we got audits, every time they see, when I try to write anything regarding the patient, the auditor will see if I have written handwritten, I have the date and the time and my signature. I need to say the patient visited this time and the patient came for the routine clinic and came on this particular time, and I have to sign it. That is a must. If you don't, it's actually a malpractice. Okay. And if digital, they must be traceable to the person who provided the care that is being documented. So usually many developed countries, they don't go for handwritten because we are in the 21st century, far ahead in the world in terms of technology. So much we have come, but Sri Lanka unfortunately is still in the era of handwritten documents. So it's not a very efficient thing. It is stressful for the people who keep this also, and it is very inefficient. It takes a lot of time because you have to go file by file and page by page. But if you put it in a system through a barcode or just by one number, you can, you can get all the information. That's the most efficient workflow to have. Okay. Ensure that you are up to date in the use of electronic systems in your place of work, including security, confidentiality, and appropriate usage. Can somebody tell what does this mean?
I think X-rays. Hello, ma'am.
Yeah. Yes, tell. I'm listening.
I think X-rays, MRI scanners, or anything else. We should, after print that, we should sign and certify that, and get our responsibility for that.
Excellent. That's a very good point. Just imagine MRI means you're taking MRI, CT means they are one of the most expensive scans. And if you're doing an MRI or a CT means you are doing something very critical to the patient. So you should be very careful if you are the radiologist who is taking the MRI or the CT, you should sign. You would have taken if you have taken MRI or CT for your health, or if you had parents whom you had to take, you would see in those files definitely the radiologist who is in charge has signed. That's what I'm saying. Record keeping is like very important. So that one thing is the innocent people are not going to get blamed if something has gone wrong. They could always go back and see who did this. This is why when I did clinical trials, always the auditor will come and check who did this particular clinical trial. Because if I have done the mistake, the advice or the action should be for me. I mean, no one can put the blame on the next clinical researcher. That's why the sign and date signature is very, very important when you're taking record. Okay, so that's a good example. Thank you for that. So record must be completed accurately and without any falsification. That's a very important thing, and provide information about the care given as well as arrangements for future and ongoing care. You can't like forge any information, Like I will tell a personal experience, like a person who was working with me in clinical trial. She tried to put false information about the patient. And then what happened is she, I think, later realized that she could get caught and she deleted it from the system. But when we put record, we are usually monitored by the sponsor in Australia. So they found out that she had put the information and then she deleted it, and then she put another information, and then they asked us to send a scanned copy of the patient's real clinical notes. So many problem, and actually she had to leave because she got caught, and it was actually a bad thing because you can't because now in clinical trials we have to take patients based on the patient's, say if it's a stroke study, based on the BP and all. So I think because she wanted to take a patient to the study, she actually forged about a patient's blood pressure value, which is very wrong. You can't do, because if you are forging a patient's blood pressure value, if it is high and you're putting a low value, imagine you're giving a drug based on that value. So the patient, but actually what happened is based on what she did, the patient actually went into a severe low BP. So when the BP going very low means the patient can die. So this is one of the reasons why I said I didn't want to work anymore in clinical trials in Sri Lanka, because I didn't see anything ethical happening to the patients that were being taken to the study, right? Because these are the types of people that you encounter. But of course, in other countries, they work with a lot of values, ethics, and they always worry about the patient safety, not about you. Okay. Jargon and speculation should be avoided. Like, you don't need to say, oh, the patient is, very beautiful, the patient is this, the patient is that. No, those are jargon. You need to be very, very professional, very relevant record keeping, name, age, diseases, all those things, nothing more, nothing less. When possible, the person in care should be involved in the record keeping and should be able to understand what the record's saying. Like, for example, if you went to one doctor and say next month you're going to the other doctor should be able to read what the previous doctor wrote about your history. You understand? So every doctor, when they're writing a record about a patient, they need to be specific, they need to be clean, they need to be neat in their writing. Okay, that's very important. And of course, readable, because like even when we were doing clinical trial, every patient history record we need to photocopy or we need to send a scan to the sponsor. So every doctor, have you ever seen, usually doctors don't have very neat handwriting and it's very difficult, right? But they should be encouraged that they need to write neatly, cleanly, even if it's not like like neat, at least it should be readable. Like the letter should be like readable, which is important. So in rare case of needing to alter record, the original entry must remain visible and the new entry must be signed, timed and dated. So if you want to see a summary, so far what we have learned is if you want to have a proper record keeping, the basic patient's details should be there. Name, age, gender. What are their past medical history? What are their allergies? All those. And aside from that, people who are doing the record keeping need to sort of like be mindful how they take the recording, right? They need to write it neatly. They need to write only relevant information. They should not falsify anything, right? They should, handle it very carefully. No one should have access except the patient who has direct contact only. So those are the general housekeeping rules when you are doing a record keeping for a patient. Okay, so the record should be kept in the format that it can be linked with other information like anyway workplace exposure measurement. Also, for example, in America, usually you need to tell what kind of work you're doing. There is a database recording, but in Sri Lanka, really not so much. But actually, I personally think every doctor will usually ask, what is your job? Be it a doctor that you are going for a physical thing or a mental thing, a doctor is completely entitled to ask what kind of job that you're doing. Okay, because usually the type of job that you're doing has a lot to tell with the health condition. So, for example, a lot of people who work in factories, their lungs become very weak after some time because the factory is a place that we have so many bad chemical and toxicants. So that is very scary, right? So that's why some people, though they don't smoke, can die from a lung cancer because some chemicals that you work in a factory can really damage your lungs. It can lead to toxicity and then eventually lead to cancer, right? That can happen. Any questions so far that you need to know or add?
I think on the on that that will be uh, we we must give the self study, and we must give uh, I think uh, how we can use uh, no, we should follow protocols, no,
Yes.
about when we using chemicals, when we using and protocols and using PPE kits.
Mhm. Exactly. So those are the things. That is why I said at the beginning, every employee has the right to ask for their rights if they are working in these toxic environments, and the
Yeah.
place who are hiring these people also should give them if they are working in a toxic place. That's, can you see how now everything is connected? See, now you all can argue out. That is why we need to have PPEs. Very good.
Yeah.
So you all are now able to condense. This is why the lesson is should be interactive, because when you all talk and participate, you all have the way to answer questions. That's why you
Okay.
should interact. So that's a very good answer. Excellent, right? Okay. But the problem is countries like Sri Lanka, especially third world countries, like, because they have a cost cutting, especially what we are going through in Sri Lanka, like, they won't even think about giving PPE for people who are working in toxic environment. Everybody, even the people who are now trying to get the money, they don't even worry about, their safety, as long as they get a money and if they can feed their family. So it's actually in a very sad state. They also don't fight for their basic rights, and the people who are hiring for them in the company are also not going to give that. So that is the thing that I'm trying to say. The repercussion can eventually be very ugly. It can be very detrimental. Okay, so that's a very sad state to be at in a third world country. But in a country that is very developed, you don't need to ask for your rights. They automatically will give you. They know you're coming to a work in a very toxic environment, so they will be entitled to give you those safety equipments because that is the correct thing to do. Okay, right. So if you are collecting an historical record of jobs or tasks completed during current employment involving exposure to identify substances requiring health surveillance, it is useful to store them with this record. So let's say that you are someone who worked in a factory, say in a plastic factory. So microplasticity can go to lungs, cause a lot of toxic. So you found that your place was not good for you, so you're going to another better place that you need to work maybe with more like a clerk, paperwork. So that company will sort of find out, okay, this person was previously in a sort of a plastic company, now has come to this job. So usually an HR will usually find out what was your previous job. That's why human resource is important, because HR is the one who takes charge of the person's physical and mental well-being. That's why when you have any kind of harassment in your workplace, you could immediately go and report it to the HR, because they have the right to sort of, look into it. What are your problems? What are your ways that you are being unsafe? Okay, so those are things that the HR will look into. Okay. So again, what are the health records should not contain? So I said we should not have any jargon. So can you all elaborate a little bit more? What are the things that you should not have?
I think we should protect their privacy and uh, uh, with, some patients don't like their uh, they are identifying in his him or her name. So they like sometimes we learned about that previous lecture. The some people's like their nicknames. Okay.
Yeah, that's correct. Like, sorry, did somebody join? The thing is, when I do the lecture, I'm unable to see the names of you all. That's what did we have anybody joining in now? So we have. Okay, no problem. Yeah, that's a very good thing. We don't need to like add all these like, how to say, pet names. I can say this patient, beautiful is this patient. No, you don't need to know those kind of things. Like very important things, like health records should not contain medical record, as they contain confidential medical information. Now I'll come to this now.
Financial information.
Right. Yes, that's the way. You don't need to know that. You don't need to know that. What is your income like? Now, the first point, can I just emphasize here? What do you mean by health records should not contain medical records? What does that mean, to be honest?
Private information.
Okay. Yes. How does a health record and a medical record differ, students? Can you all sort of differentiate between the two? Health record, medical record. Somebody just said, but can you tell me what is a health? Like, it looks like both are same, right? Like, people can get a bit confused. What is a health record and a medical record? Can you sort of like guess?
I think health record is not included in his current situation, or that about that is not about some disease. So what we want, if we want health records, I think medical record is about some disease or yeah, I think that situation, that current situation mentioned in that.
Who can I know the name who answered this?
I'm Janaka.
Janaka, thank you so much, Janaka. That's really, really a very good answer, to be honest. Because health record, like medical record, is like it was in the something like medical means something the patient's past history, right? Like patient could have had cancer, patient could have had a liver failure. No, you don't need to really put that in a health record, right? Health record should not contain medical record because that is like getting a patient's past private information. But a health record like the name, the age, that kind of things need to be there. So thank you, Janaka. That's really good. Well done. Also, health record and medical records must therefore be kept separate to avoid any breaches of medical confidentiality. Can you see? That is very important. You need to have it like two separate things. Okay, that's there. But a doctor can see both the health and the medical both, right? But maybe the reception in the hospital, no. If it's her duty to only take the health record, then the patient should only give the information for the health record. She can't take the patient's medical record because usually a medical record contains a lot of personal information, which is only entitled to the people like doctors, nurses, and researchers. Okay. Any personal medical information should be kept in confidence and held by the occupational health professional responsible for the health and surveillance program, only for the doctors, nurses, and researchers. So medical records are compiled by a doctor or nurse and may contain information obtained from the individual during the course of health surveillance. This information may include clinical notes, biological results, and other information related to the health issues not associated with the work. This information is confidential and should not be disclosed without the consent of individual. What do you mean by this word? Without the consent of the individual? Can you tell me, students, what does that mean?
Without their confirmation, without their knowledge.
Exactly. You should.
The patient.
Now, for example, like let's say, is this also Janaka? Is it Janaka? I'm sorry, I can't see your name.
Yeah.
Okay, so Janaka, that's good. Because, let's say,
I think he's Fayaz. I'm
sorry.
Janaka.
Sorry, okay, whoever answered that, like let's say that I wanted to say that somebody's asking me, okay, Miss Afida, is it okay that you know, say somebody of y'all is a doctor, so y'all are asking me, can you tell me, like, in the past, did you like have any symptoms with regard to, say, migraine or say stomach issue? So you're a doctor and I can answer because you all want to give me a diagnosis as to what I need to take, right? Or for research purposes, you're asking a patient, is it okay that you could give me your medical history? Now the thing is, there's a catch in this. The patient also needs to know who is asking this information. Patients are not dumb. Okay, patients are not dumb. They know who is a doctor, they know who is a nurse, they know who is a medical research. So they also need to be mindful, okay, who am I giving the information? So just if a normal random person in the road comes and says, hey, you know, Taranga or Janaka or Fayaz, or give me your medical history, will you all give? No, you all can't, because who are they to ask your medical records? They can't, right? So the specific person medically should be qualified to get it, and they need to have your consent. Now another word for a consent, I would say kidney
Unauthorization.
Yes. So let's say a kidney transplant, you are matching to give a kidney to your mother, right? So the doctor has no right to take the kidney forcefully from the son to give it to the mother. Unethical. The son may be a donor to the mother. Yes, the son can save the mother's life, but the son has to agree to sign the consent form. I am willing to give the kidney to my mother. Only then the transplantation surgery can happen. Can you see the importance of consent? Because end of the day, it is their body. They have their right to decide whether they want to give or not. So of course, every child would want to do it, right? A loving child will do it for to the mother through love. But what I'm saying as an example is, you cannot, without a consent, operate without the knowledge of the child to get the kidney and transplant it to the mother, right? You cannot do that. That is what you mean without the consent, okay? The occupational health professional may obtain data as a result of an immunization program. So, for example, blood titers or non-responding information. This information will be provided to the employee and should not be given to the employer. It will be kept in confidence by the OH professional and should only be made known to the employer with the employee's consent. See, this is a very important paragraph. There is someone called occupational health professional. Like, let's say somebody let's say the person John has joined a company. He has some sicknesses, right? His sickness should only be known to the OH professional, but not even to the boss. And the boss can only know if the patient is willing to give that information. Is that paragraph understood? Yes or no? The employer will not know about John's information without John's consent. So if I am to repeat again, a person called John is coming to a company to do his job. He has joined newly to the company to do his job. So his boss has now hired him because he has the skills, he has everything. But the boss has no right to ask John's medical history, nothing. He cannot ask unless John is willing to give that information to his boss. Is that understood? Students, yes or no?
Yes.
Yes.
That's
Yes.
simple English. I'm getting that. Okay, right. The doctor or nurse should only provide employees with information on fitness to work and any restrictions that may apply in that respect. So, like for example, someone who is very overweight comes to the company. Okay, so usually the general thing is people are sort of judgmental. The moment you see a fat person, you think, okay, he eats a lot, that's why he's fat. People are very judgmental. They don't want to know why he's getting fat, because gaining weight is not just about eating a lot. Sometimes when people are on steroids because of autoimmune diseases, those drugs can make a person to gain a lot of weight. And it's so sad that sometimes these are the patients who don't even want to eat because they are sad because of the drugs that they are getting fat. That is why it is very wrong to judge a person based on what you see, based on what you hear. You need to really go in depth to understand what is the real cause, right? So even if you get to know that person is gaining weight because they eat a lot, that is also another sickness. Could be because of depression, could be because of another sickness, right? Anything. So any company, when they hire, they can sort of ask about like fitness in work. Like, for example, when you are getting hired to a gym, so a gym coach should be sort of like in a fitness, in a fitness level, right? Because, of course, someone needs to be fit so that the other person can, train how to be fit. That's a different story. But like, you understand what I'm trying to say. So anything you have to sort of respect. That is very important. Anything needs respect. Okay, how you talk, how you approach, how you convey a message. Like I said last time also, anything we get angry, that's normal, no problem. But the language that you use or how you convey the message or how you say it is important. That is a must. Humans are normally, like I said, and even when you want to give something, you can always tell it personally, right? That's important. So respect is important, right? So that's what they're trying to say. Any information you can get, but you need to do it in a respectful manner. Like if you see someone a little bit overweight, you can sort of ask, how is your fitness level? Like, do you have sometimes finding, like the manager can ask, oh, we don't have an elevator, we need to usually take the steps. Do you find it okay to climb the steps? Those basic questions you can ask through courtesy. That's all right. Okay, that's an example. Okay. Any questions so far? Up to now, is it clear? We have around
Yes, ma'am.
we have around 34 minutes. So if you have any questions, please ask. Okay, right. Other types of record keeping used in the healthcare. So first one is individual staff records. Why do you need to have individual staff records? You can read what is on the slides and sort of guess it. And can you explain it to me? Students?
I think top management should maintain all records about their employees and they responsible responsible their government and government and they are working under the different types of acts. So they should uh, maintain all records their staff.
Yeah, so
Okay.
like for example, here it says hospitals not only keep records of their patients but their staff members as well. So that's very important, right? Like HR is a department that keeps a record of the people who work there. And you understand now the nurse for example, I'll give you a very simple example. Doctors and nurses are not going to keep a medical record of the other nurses and other doctors they are working with. No, is it understood? Whose records will they take? They will take the records of the patients. But the HR will take the records of the nurses and doctors. And they also have the patient's records also. So do you understand? So it depends who is taking the record. Okay. The record is an account for the staff's basic necessary information, previous medical history, personal note, and more. Right? So this is general about record keeping. So don't get confused about medical record and health record. This term, please don't get confused. Now we are just talking about general record keeping. So for example, if it is the doctor who is taking the record, the doctor needs to take the patient's medical history. If it is a normal reception who is taking a record of a patient, she needs to take a what record? A health record. එක තේරුණාද? පැහැදිලි මදි නම් මම ආයෙ එක කියන්නම්. Is it confusing, students?
No, madam.
Okay, good. Okay, right. So that's that. So the second one, can somebody answer about ward records? What does that mean?
Section by section, there must be record.
Excellent. Now make a NHSL එකේ. I don't know how many of you all have been to the National Hospital of Sri Lanka, right? In that you have so many wards, right? So many wards. So each ward will have around 10 to 15 patients. So each ward must maintain information for those respective patients. Otherwise, just imagine the whole, in the when you go to the NHSL, you have the eye hospital, the eye department, and then you have for the gynecology, then you have a diabetic clinic, you have the cardio health, cardiology unit. If there are so many units and each unit will have so many wards. That's why it's so big. So imagine you just have only one record for the entire hospital. Just imagine the madness that can happen. You can kill patients. You can never get any work done. So that's why for every ward, you must have a proper inventory. Inventory. Like you have like a, if you take those days, I know now, I don't know whether you all have seen those days. I think during my dad's and mom's time, they used to have a phone directory, right? You can find anybody's name and you can find the phone number. Like that, you have an inventory for every ward. This patient name, this patient got admitted on this particular day. This is the patient's record. Like that, you have an inventory. That is what you call a ward record.
The inventory means I think there how many beds there, how many chairs there, how many.
As an example,
Yeah.
an example, right? Inventory.
Okay.
Like you can have an inventory. Yeah, beds, chairs. It could be like anything. It could be equipment. I'm just giving an example, right? Anything.
Okay. Okay.
Yeah, or it could be even.
I think even that should be there, no? Even in our ward records.
Yeah, definitely. Oh my God! Now you remember COVID time? It was important to know how many beds were there, right? That's otherwise, yes, please don't send any more COVID patients because right now we have only this amount of beds. You understand? This amount of beds, we have no more, or like you said, not just a bed, even in ventilators. Sri Lanka was going through a ventilator shortage, right? And patients had to put them on ground. So many.
Then we can order first priority medicines for wards and ordered anything else, no?
Yes, Yes, so that's correct. So that's correct. That's why. Do you remember? I told you like we actually collaborate with different clinicians so that when you run shortage of things, you collaborate with them so that you can get sufficient equipments. Do you remember that?
Yeah.
Okay. So that's a very good answer, right? Board records, very good. So the third point, we go for an administrative records. Why do you need to have an administrative record? What is the importance of administrative records? Can somebody answer?
This includes the entire records of the entity, like employee numbers, how many goods are available, the tables, chairs, and everything has to be there in the administrative records to provide a systemized and managed operation.
Right. That's correct. Anybody else who can answer for that?
It is about the who is managing and responsible for the running business or something.
Correct. Yeah, correct. So, like, can you see when you want to like carry for a healthcare, how many kinds of records you have? You can't just have staff record. You should have board records. You should have administrative record, because you have to understand in a hospital you have so many departments, right? So every department will have their own job role. You understand? If not, you cannot carry out a workplace efficiently. It's just like a school. You need to have the principal, you need to have the teachers, you need to have the HR, you need to have so many people for the school to function properly. So likewise, you need to have records also. If you don't have records, if somebody comes, a doctor comes, do we have a patient for this? Do we have a bed for this particular patient? If you don't have a bed, can you send the patient to this hospital? No, you cannot. So that is why you need to have proper record keeping for efficient flow of work. Is that understood, students?
Yes, ma'am.
Yes.
So the last one is historical records, research records, electronic records, and fiscal. So fiscal means financial records. A few are the examples. So previously, I think somebody said that we don't need to have financial records. Financial record we don't need, but depending on what is the situation, like depending on what situation is. Like now here, it's a record keeping for a what do you call, for a department to work properly. Like we understand anything end of the day, if you don't have financially you don't have financial stability, nothing can flow properly, right? For a hospital to get proper beds or ventilators or whatever it is, you need to have financial means, right? That is why you collaborate with other sponsors so that you can have facilities and you can have equipments for your patients. Is that understood? So you need to, somebody will have an inventory for this also. Okay, this particular month the hospital bought 7 to 8 beds. We are running short of beds, so we need to have more beds for the patients. Like COVID situation, many were having shortage of ventilators. So what we need financial what you call support to buy sufficient ventilators for people who suffered with like severe COVID situations. Okay, so that is a must. But of course, in a medical record, a doctor will never take a financial report, right? A doctor has no right to ask a patient, oh, so for a month, how much you are earning? No, a doctor will only have to get the history. What did you suffer? What were your symptoms like? That is the only thing that you need to report. Okay. Students, did you all understand that? Taranga, do you have any questions? Or anyone else? Because I cannot see your names when I'm on the screen. So anyone can ask, anyone can add anything that you all feel that may you all want to contribute.
No, miss.
Okay.
That
Yeah.
I
Yes.
the one who told about the financial matter, but you gave the answer last moment.
You understood, right? You understood.
Yeah.
So if I'm to summarize what I mentioned so far within this few minutes, what I said was record keeping in a healthcare management. Why do you need record keeping? And most of you all answered very well. Most of you all said what kind of record in a record keeping, what are the things that you need to include. Then I explained to you between a record keeping, it can be a medical record, it can be a health record. And you have to understand medical and a health record are two different things. Information coming in a medical record is different to the information that comes in a health record. Okay, so you need to understand the difference. And I told you who has access to see your health record. A person like the reception will have access to see your health record. But a medical record, only a nurse, a researcher, or a doctor can only access to the medical record. Okay, so that you need to understand. Okay. So last week I said that I will have a Kahoot. So this week I will try one last time to see if the game is going to be successful. If it's not successful, I will go to another quizzes like thing. So let's just try one last time. So if you all have your phone or your laptop, just type the word Kahoot. Okay. Just type the word Kahoot. We have 15 questions. I think, can you all see the screen now? Can you all see this screen? The one that I'm saying healthcare and management. Can you all see this on the screen? Can somebody please answer, because we have just 30 minutes more to end the session.
Yeah, I can see.
Right, very good. So just go to Google, like I'll just show you like last time. Type Kahoot, okay? Just type Kahoot. And the one that you all see this, click that. So far, can you all see this, where you all need to enter a PIN number? Can you all see that?
Yes, ma'am.
Okay. So now what I'm going to do is I'm going to start the quiz. Hopefully it's going to work. Oh God, I need to charge my laptop. Hold on.
What is the pin, ma'am?
I'm coming. Just give me a second. I'll just charge my laptop. I'm so sorry.
Okay.
Just hold on a second. Right. Okay. Let's see. I'm going to start and I'll give you all the PIN number. So far, y'all can see my screen, right? Yeah. All this time, y'all can see, I think.
Yes.
Okay. Okay. So far successful. Hold on. Okay. Get ready to join. And okay. Can you all see the PIN number? 5125869. Can you all put the PIN number? 5125869. Okay, so Janaka, Fayaz, and Taranga have joined. So today, finally, it's successful. Only 3 people. What about the others? Okay, Hilani is here. Only 4 people? That's it? Taranga, how many are in the, like, where are the other people? Janaka?
I am here.
Okay, Janaka is here. Okay.
Janaka is there.
So what about the other students? Only 4 have joined. We'll wait for another 1 minute just to see maybe anyone is having trouble to join in. Whoever is on Teams, can you all say that if you all are having like issues to join in to the Kahoot? What about the other students? Whoever is muted, can you all unmute yourselves? Roshan, Shehara, Lumala, Sanduni. Okay, I think maybe since the others are not responding, maybe can I start? Students, the 4 of you all who are in the game, can I start?
Yes.
Okay, ma'am.
Okay, let's start. Okay, first question. What is the answer? The 3 greatest challenges facing India's health system are accessibility, availability, and what is the answer? You all have 20 seconds to answer. Okay, did everyone get that right? The answer is accountability. Okay, so let's go to the next question. Okay, I will discuss the answers as we go on, right? One. So Fayaz is leading. So, and Fayaz. Health and managing an extraordinary stressful cause. Well done, Taranga. Good. Silani and Janaka, you all understood, right? Yeah. You got it? Go to the next one.
Who is often recognized in the first hospital administrator? hari ini Florence Nightingale.
Well done. False.
All the information that must be managed in a healthcare organization is protected here. Ayyo.
Anybody understood? False. Okay, let's see who. Tarang, you are leading. Very good. So, students, up to now, any questions that you all couldn't understand? Anything that you all feel that you all think is a different answer? So Fayaz, Janaka and Tilani. Leading Fayaz, second Janaka and third is Tilani. Okay. Good. Tilani, excellent. Good job. Okay. Try and guess this. Okay. Let's see. Last question. Okay, so Fayaz first place, Tilani second place, and Janaka third place. Well done. So did you all enjoy the quiz, students?
Of course, ma'am.
Of course, yeah.
Yes.
Great, right? So let's try to have sessions like this. So finally, the third attempt became successful. I was very happy the quiz turned out well. What about the other students? I didn't hear anything. Only 5 participated. Is there anybody else who is not like in the lesson who has like gone off? I mean, I didn't hear anything from Lumala, Roshan. Physically, they are somewhere, I guess. Okay, so we have actually 4 minutes more, and I actually wanted to show a couple of videos, but I think next week we will I'm sorry, next week we will actually watch the videos. Can somebody recap the things that we studied today? Can somebody sort of explain to me right up until today, like what was the thing that we studied? Like we studied about like what is risk management in healthcare, right? So y'all, I'll just go slide by slide. Any questions with regarding to what is risk management in healthcare? Anyone has any question? Just like a small recap. Students, come on, somebody answer, please. Just 3 minutes, a quick recap. Students? Hello, Fayaz.
Yes.
Right, so understood, right? Okay. So we learned about that and just on the headings, okay? How to support others to comply with health and safety requirement we studied. And also what is record keeping? Again, you need to know the difference between medical record and health record, who has access to the medical record, who has access to the health record, right? And what are the things that you need to have in a record keeping? It is important, like name, gender, date of birth, and so on. And key principles of record keeping, to say it in summary, it has to be neat and it has to be clean and it has to be clear, right? And what are the things that should not contain in a health record is like short word. You should not have any jargons, okay? So that is very important. What are the types of healthcare records that is used in a healthcare system? Staff, board, administrative, and so on. So, and then we did a quiz. So I have actually around 6 videos to show. But because I think, yeah, we just went through the quiz, it took around 15 minutes, right? Any questions, students, right up until now? We have a minute to go because I will be starting the 5 steps to a risk assessment and starting off with the videos next week. Within this 1 minute, any questions that you all like to ask? Anything that was not clear? Taranga, from the quiz, anything that you didn't understand? The people who couldn't get a high score, any doubts?
No, miss, that is problem is time management. I will try next week.
Okay. So next week also you will have a Kahoot quiz. You will have a video. So is the session okay today? Any suggestions? Any feedback? Y'all are okay, right?
I just want to know that I answered correctly ASH something actually because I was clicked on assuming.
Yeah, really.
So what is that Asian?
Yes,
the
I'm
quiz?
also doubt about it.
Okay. So can I send what do you call a Word document of all the right answers with the questions? Is that okay for y'all? Before the
Yes.
that would be better, right? So y'all can go through with the question and answer. So I'll definitely do that. I'll get the question and also the relevant answer. So y'all can go through it again. So hopefully I will see y'all next Sunday. And I think again next Sunday I will be with this time. I actually spoke to Miss Chammi because I told you like Bangkok, I'm 1.5 hours I'm ahead of Sri Lanka. So hoping to see you all next Sunday. So I'll send the slides and also the answers for these questions. Okay. So are we all good, students?
Yes.
Okay, madam.
Okay, right. So thank you for joining for the class. As always, you all can write to me if you all have any questions, any doubts. So next week, I'll see you all again from 12 p.m. onwards and with the new slides. And we'll start next week with the video and we will go with the lectures and we'll have a Kahoot quiz. So until then, I'll see you guys and have a great Sunday. Okay.
Okay, thank
you,
you.
Miss.
See you.
Okay. Yeah.
Good
Bye.
night, madam.
Bye. Dear.
See
Bye.
you. Bye.
Same, ma'am. Thank you very much.